Hello, everyone. Thank you for joining this session. My name is Amanda Krupitsky, and I am the Policy Director at the Autoimmune Association. And joining me today, we have Dr. Bassem Khan, who is the CEO and a physician at Neighborhood Health, which is a federally qualified health center in Northern Virginia that serves over 34,000 patients. Thanks for joining us today, Dr. Khan.
Thank you so much. It's great to be here.
So I, am so excited to have you today because I'm not sure that, many of our patients, know what a community health center is, know how a community health center can help them save money on their medical costs, and then know what the 340B program is and how they can access prescription drugs through the 340B program. So if you'd love to give us a little bit of background about community health centers and the 340B program, I'm sure everyone is really curious to learn what those are.
Thanks, Amanda. I think it even took me a while to figure out what a community health center is. I actually grew up abroad in a third world country, and because of that experience, wanted to, when I became a physician, work with underserved population. And when I moved to this area in Northern Virginia, I found our local community health center and realized that it provided services to a lot of patients who did not have health insurance, people who were on Medicaid and maybe couldn't find other doctors, and just people who struggled to get access to care. And the Community Health Center program is just a wonderful program that a lot of people haven't heard about. There are about 1,400 community health centers across the US, and a community health center is a nonprofit organization. And each one actually might have multiple clinics. And these community health centers provide care to those in our community who might otherwise struggle to get access to care. So we serve patients who are uninsured. We serve patients who have Medicaid or high copays and deductibles, or anyone with any insurance as well. We sort of take all comers, if you will. And the services that we provide are primary care, so primary medical care like internal medicine or family medicine or pediatrics, women's health, including prenatal care in many cases, just sort of your well woman visits and screenings as well, lab services, dental services, mental health, sometimes substance abuse treatment. That's increasing now with all that we see that's going on. And then different community health centers might have different services. We have vision services, for example. There's case management as well. So really a broad set of services, not specialty care that often. So that that's a separate situation. And one of the services that you talked about is obviously the 340B pharmacy program. So we try to do whatever we can to make sure that services are available to our patients that otherwise it might be difficult for them to get. So that includes access to medications. So for our patients, we are able to get them low-cost medications that sometimes they would have difficulty affording in other situations, whether there's someone who are uninsured or whether there's someone who have insurance. But as you know, with insurance plans these days, the cost sharing is so high, and sometimes the 340B program really helps with that as well. So I've been practicing now for 14 years at our community health center, including a lot of patients with different autoimmune conditions. And the program has been very beneficial in being able to get access to certain medicines for our patients where otherwise they would not have been able to get it.
Yeah, absolutely. And I think, something really wonderful to note about the 340B program is a lot of that money that goes into the program is also kind of reinvested to the community health centers. So you can continue to provide that broad array of services, which I think is, incredibly wonderful. So a lot of our patients, all of our patients have an autoimmune disease. Many of them have more than one. I think the national average is 25% of people with one autoimmune disease have more than one. So a lot of that can come with financial challenges because, healthcare in this country is expensive. Do you have any advice for patients dealing with these financial challenges or with their medical bills or things of that sort?
Yeah, it's such a problem because, for many patients with different autoimmune conditions, I've seen this in my own family, with rheumatoid arthritis, and I've seen it with many of our patients as well. Oftentimes, you're already struggling with so much, just staying out of pain, maintaining function, oftentimes having to care for family members or a little child. To have financial challenges on top of that, being able to access basic healthcare or medications or specialist visits is just something that shouldn't be the case. And what I would suggest is there are often a lot of different resources that are available to people that they're not aware of. Obviously, if you want to look into getting primary care at a community health center, that is an option that could be helpful. If getting primary care is otherwise too expensive for you, or you have difficulty finding a doctor who might take a certain insurance, especially Medicaid, or you're low income and don't have health insurance. Oftentimes, we look at how much income people make, and then based on that, there's a sliding fee scale that is affordable. So that's obviously one option. But beyond that, there's also, if you get bills from specialists, and especially from hospital and health systems, you always need to look into their financial aid policies. Oftentimes, I've run across lots of patients, not only in my clinic, but also just people I know in the community who receive these bills and think they have to pay them, but oftentimes you need to look and see if you qualify for a financial aid policy. They go up to, certain income levels, and if you qualify, the care can be lower cost or it can be reduced. So it's oftentimes it's on the hospital websites, or you can ask someone, but always ask if there are financial aid policies or options available. And then with medications, the same thing. Often through the drug companies, there are patient assistance programs, regardless of where you get your care from, where you can get access to medicines for low costs. Different times, if you're at a community health center or another place that has a 340B program, that's an option. Often, maybe switching to a community health center for that reason might be worth it in your case. And sometimes the medications are pretty similar. So maybe in certain cases, I know this isn't always the case, but switching can be helpful as well. So it's not a great system. I mean, we all know that, but there are things that people can do to try to reduce the cost burden, which unfortunately is just too much. If in many cases.
Yeah, absolutely. Thank you so much for sharing all of that about your health center and ways for patients to save money. I think, it's really important for people who may be struggling with their costs to see if there's a community health center near there where they can go get their care. And there should be a link in the chat to an online resource from HRSA that you can check to see if there's one near you. So thank you so much for joining us today, Dr. Khan. And we're going to talk a little bit now about the policies that are impacting the community centered around 340B. So, as we talked about, the 340B program has been around since 1992, and it allows covered entities like community health centers to purchase prescription drugs for discounted prices. This is really important because they get to use some of that funding that they get from those drugs at point of sale to reinvest into their health centers to keep providing those low-cost services that they do to our community. And then regardless of your status, if you receive care at a community health center or other covered entity, you can qualify for 340B drug pricing. Something that is concerning to us at the Autoimmune Association is that only 1.4% of 340B eligible locations pass their prescription discounts onto the patient. So some things that we're working on in the states to kind of counteract that is some transparency legislation around 340B that will require hospitals and other entities that don't necessarily pass along their savings to patients to do so. So they would have to disclose how much charity care they provide, and then what percentage that they're taking from these 340B drugs, and then adding to the cost. Sometimes this is also the PBMs that are participating, and they are shaving some of the savings and not passing those on to patients. So we're also looking into that as well. So Michigan and Ohio are two states that are currently in session. Michigan through early January and Ohio through the end of the year. In both of these states, we are kind of watching the legislative calendar. There is an election coming up. I encourage everyone to register to vote. And through the election, we'll kind of wait and see what happens to kind of anticipate what they will do in their lame duck sessions. Federally, we have the 340B Access Act. This bill, it would ensure that discounts are being passed down to patients. So this would, cover all of the states, and it safeguards resources like community health centers to protect their mission-driven work and make sure that hospitals are doing the same and being transparent and reinvesting the money they make from the 340B program back into the patients that they serve. Unfortunately, sometimes we're seeing that there may be some misguided incentives for hospitals to, purchase sites that have 340B programs and then take the funds that they earn from those sites and reinvest them into other communities. So that is something that we are, aware of at the Autoimmune Association and are looking to curtail. So those new transparency measures that are included in this bill would cover those changes. So this is an issue that is obviously, we expect more states next year to introduce legislation at the state level. So we think between 22 and 30 states are going to be making laws in the 340B space. If this is an issue that you care about, we have our new Autoimmune Legislative Action Center on our website, and there should also be a link in the chat for you to access that. We have a page specifically talking about 340B and the details that we are looking to promote within the program so that patients can access prescription drugs at lower costs. So if you're interested in becoming more engaged with us on this program, there is a survey at the bottom of that page that you can fill out, and we'll be in contact with you soon. And this is also, an issue we're thinking about bringing into our fly-in next year. So I look forward to engaging with more patients on this issue. And if you have any questions, you can leave them in the chat and I can answer those at a later time. So thank you everyone so much for joining this session. I really appreciate it.